My name's Lydia Boyd and my role at Thinkaction is a senior psychological wellbeing practitioner. Often when people are feeling low or depressed, they'll start to notice themselves feeling maybe less confident, their self-esteem might feel a little bit lower. And of course we all feel anxious or low at some points in our lives, and that's quite normal and common. But what we find is when these feelings start to impact on our day-to-day functioning, so we're not able to get up and get moving in the morning, or we start to have time off work, that's when we kind of suggest that it's the right time to seek support for those feelings. Some other feelings when you're feeling quite low, maybe that you're not feeling as motivated as you normally would do, and just that general kind of sense of well-being starts to reduce. Some triggers for noticing these feelings of low mood might be that you've had a situation happen, so what we call a life event. So you may have lost somebody close to you, you may have lost a job, something might have just changed in your life that you're finding quite difficult, and that can cause symptoms of low mood. Or we can just start to see a habit, what we call an unhelpful habit. So you might start thinking more negatively, and that can then sort of cause levels of low mood, and those two things sort of have a relationship with each other. So the more low we feel, the more negatively we think, and the more negatively we think, the lower we feel. So in sort of the treatment of low mood, we will use something called cognitive behavioural therapy. And as I've just said, this focuses on both the cognitions, so your thoughts, and your behaviours, so what you do and don't do to cope with the low mood. So with the thoughts, we can start challenging some of those unhelpful thoughts that you're having, start seeing whether those unhelpful thoughts are valid and true, and we challenge those with evidence. So we say, for example, you might have a thought like, I've got no friends. Well, let's look at the evidence that either supports or doesn't support that thought and rebalance your perspective. So we're changing this, what we call an unhelpful thinking habit. So that's kind of a brief overview of how we'd look at the thoughts. With the behaviours in low mood, again, like I said, what we often find is that your motivation is impacted. And we often think to ourselves, I'll only be able to do the washing up when I feel motivated, but that motivation may never come. So the washing up never gets done and we feel bad about that. So what we need to try and start doing is looking at, okay, what activity can I do to start the increase of my motivation? So that activity is coming before we feel motivated. Because what we often find is then, once we're doing an activity, our motivation increases and we feel more enthused and motivated to continue with that activity. And the way to start that is just breaking the activities down. So with the washing up, for example, you might say, all right, I'm going to wash up 1 cup. Once you've washed up the 1 cup, you might feel like, yeah, I can do another one. And it's just about changing that behaviour.